Hello, I am Dr. Petar Novakovic. I'm a specialist in family medicine practicing in Chandler area and Phoenix area for the past 20 years. This segment is supposed to introduce you to a technique that I have used to treat pain for the past 2.5 years. Technique is called perineural injection technique, P.I.T. in abbreviation, and it was designed by Dr. John Lyftogt from New Zealand. The treatment is used for acute and particularly chronic pain in musculoskeletal system, mostly. What kind of pain? Neck pain, back pain, shoulders, knees, elbows, carpal tunnel syndrome, heel spur, plantar fasciitis, what have you. How does it work? Very simple. Dr. John Lyftogt has reviewed textbooks and publications in medicine stemming decades and centuries back, and came to a conclusion that what needs to be addressed is not the tendon, not the ligaments, not the bones, not the muscles, but actually nerves running through those affected areas. What he found was that nerves, and particular type of nerves called slow C fibers, are the nerves affected and causing us to be in pain. What happens with them? They become compressed, rubbed against, frictioned, trapped, and as a result they become swollen. They turn acidy, they cannot be fed, they cannot absorb nutrients, they keep hyperfiring, and there you go, person is in pain. What do we use to treat those? Well, it's very simple and almost impossible to believe, but trust me, it works miracles. We inject sterile alkaline 5% dextrose using the smallest possible and thinnest possible needle, and we inject just underneath the skin, following the distribution of the nerves that we know are affected. And which nerves are affected, we will learn from the patient's history and the examination. The fluid that we inject is nothing but sterile alkaline 5% dextrose. Why? Alkalinity of our fluid will cancel out the acidity of the affected nerve. That causes the nerve to shrink to its normal size, wiggle out of the areas that it was actually trapped inside, and then when it is no longer acidy, the nerve can absorb the nutrients. Well, interestingly enough, I have 5% dextrose in that very fluid. Another mechanism of action is that as we inject the short needle, we actually are pushing fluid in, and that causes what we call hydrodissection. Hydrodissection will actually separate those nerve endings that linger underneath the surface of the skin and have them float, so to speak, in that healthy liquid. The message is then transmitted throughout the entire nerve, and the patients get off our treatment table most times completely pain-free. The success of the treatment has been stunning. I have been really infatuated by its effectiveness. I'm about to do a study because I have at this time treated approximately 2,000 people since November of 2015. But I'm about to do a study, but I can tell you right off the bat, I can guarantee you pretty much 70% of the people easy will improve. We will give you the site to look at if you want to look into the science behind it as designed by Dr. Lyftogt. You will have it placed on the screen, hopefully. And just want to conclude by telling there is absolutely no side effects to this treatment. Basically, what can happen from a little dextrose sugar water underneath the skin. That is one of the major beauties of this treatment. Do people need repeated sessions? Some people do. some people don't. I have had luck that many more of my patients than not, many more people did not need repeated sessions. I am, however, obliged to tell you that basic stance has been that people may require 4 to 6 sessions, with each subsequent session giving you the additional benefit and additional chunk of pain chronically taken away. Like I said earlier, side effects are pretty much zero. I mean, I have not seen anybody ever have any major issues with it. Smokers and diabetic patients will likely require additional sessions because they respond less beneficially to the treatment. People who use chronic narcotics will require certainly additional sessions. Some of us who perform these techniques currently in Arizona, it is basically from the medical doctors, only Dr. Greg Reeser and myself. We sometimes are very hesitant to see people who use narcotics because the pain will come back. I did on several occasions use this treatment to get a person off narcotics, but these people need to have repeated injections and then it can become expensive. However, if a person is able to maybe decrease the amount of narcotics or maybe get off for some time and then try the treatment, it may be actually very, very beneficial for that person. So once again, I'm Dr. Novakovic, practicing in Chandler, Arizona and Phoenix, Arizona. Please look up and spread the word about this beautiful treatment. I have said so many times, God bless Dr. John Lyftogt for discovering this beautiful treatment, and I thank him. I hope he may even get to see this once. I believe that that world of medicine owes him a lot. I wish you all health, and to all your people who are chronically in pain, I wish you find this or some other ways to get better. Thank you so much.